Neurodevelopmental Disorders on the DSM video. So, 103. What is attention deficit hyperactivity disorder? ADHD, ADD is characterized by impulsive, hyperactive, easily distractible behavior and a relative inability to focus on tasks and activities for prolonged periods of time. Interestingly, ADHD is known as hyperkinetic disorder outside of the United States. Didn't know that. It is shown to affect between 3 to 9% of children, but it is more often found in boys. There are multiple medications for ADHD, including dexedrine, Cylert, and Ritalin. However, the effect of these medications are sometimes controversial with their side effects and efficacy in children. Some believe they don't work at all. Psychosocial therapies include behavior modification therapy that uses a reward system for reinforcing desired behavior and completing tasks. Family therapy has also been shown to be effective because oftentimes symptoms and behaviors by a family's lack of understanding and malfunctioning contributes to ADD. Recent research has monitored sleep patterns of children with ADHD because oftentimes it is found that sleep disturbance also affects them. Research is suggesting new methods of adjusting the circadian rhythm that may benefit those affected by reducing sleep disturbance and therefore reducing symptoms of ADD. 104. Specific learning disorder. Learning disorders or learning disabilities are disorders that cause problems in speaking, listening, reading, writing, or mathematical ability. A learning disability or specific developmental disorder is a disorder that inhibits or interferes with the skills of learning. People with learning disabilities and disorders can learn strategies for coping with their disabilities. Getting help earlier increases the likelihood for success in school and later in life. If learning disabilities remain untreated, a child may begin to feel frustrated with schoolwork, which can lead to low self-esteem, depression, and other problems. Current research has found that children with learning disabilities sometimes have other conditions such as ADHD. These conditions require their own treatments, which may include therapy and medications. 105. Communication and motor disorders. Developmental coordination disorder is diagnosed in children who fail to develop normal motor coordination. There's a variety of different names, including clumsy child syndrome, congenital maladroitness, and simply clumsiness. Symptoms range from an inability to walk to being unable to throw a ball or take off their clothes or even being able to write. There is not one catch-all treatment for developmental coordination disorder. Treatment is specialized and often addresses more than just physical coordination, as oftentimes perceived clumsiness results in distress for the child. Individual programs have arisen that help kids master skills like writing, games, sports, and other classroom activities. Researchers have proven an intervention program that uses cognitive-based strategies to improve performance with specific tasks based on what the child chooses as a goal. It has a positive effect on levels of performance, which often leads to better socialization and increased confidence and independence. Okay, let's see what we have here. Autism spectrum disorder. Autism includes a wide range of disabilities, from social problems that include trouble communicating and interacting to repetitive behaviors to other symptoms that inhibit an individual from functioning socially. Some are mildly hindered by these symptoms and others are severely disabled. That's why they call it the spectrum disorder, because there's such a big range. When it comes to autism, success has been found with early intervention to help reduce symptoms and help teach ways of overcoming weaknesses and playing to strengths. However, there is not currently a single best way to treat autism. Applied behavioral analysis, pivotal response treatment, and verbal behavior have all been used to succeed in overcoming aspects of autism, but each individual will respond differently. Recent studies show that a method called matrix training can help teach generalized language for affected children. The method taught a number of action object-based responses and suggests that continued matrix training can help with toddlers with generative language acquisition. So, going on. 107. What is intellectual disability? Also known as intellectual developmental disorder. IDD, as it is known, is deficits in the child's development that manifest as poor reasoning, planning, judgment, abstract thinking, and other forms of learning. These may result in further deficits in social, academic, and day-to-day functioning. IDD was formerly known and probably is still referred to as mental retardation, but it is a more specific way of looking at the disorder. IDD is a lifelong disorder. Treatment includes special education and other rehabilitation programs that help children learn adaptive skills. Some are able to achieve relatively independent lives and are happy and healthy through such treatments. A very specific study combined behavioral intervention with a laxative therapy to help children with a history of fecal accidents. They instituted a reward system for desired bowel movements, which while in the toilet, as well as administering a laxative. For 9 to 10 weeks, this treatment was performed and had a profoundly positive effect on children with IDD with this specific handicap. Those are all the neurodevelopmental disorders. There's only one left in the DSM video, which we'll get to right after this. It's called neurocognitive disorders. In the meantime, I need to drink some water.